Take two. All right, so we're going to talk about breathing drills, why we use breathing drills to help improve hip and shoulder rotation, and why just kind of the concept behind them, the concept of getting our rib cage and getting our pelvis to line up nicely is so important for restoring range of motion. So when we talk about breathing drills, we're talking mostly about two structures: our rib cage and our pelvis, which kind of create the center of our body. So if we're looking from the front, we've got our rib cage, we've got our pelvis, and other very important structures kind of branch off of that. So we've got our scapula, we've got our humerus, we've got our pelvis, we've got our femurs. And much like we talked on many of the shoulder-related stuff about, having to have the rib cage in the right place in order for shoulders to move the right way, pelvis is the same thing with the hips. So if our pelvis is aligned correctly, we'll have good joint centration of the head of our femur and the acetabulum, and we'll be able to express all the hip range of motion that we want to express. And specific to powerlifting, a lot of the strategies that people use in order to get tight and lift really, really heavy weights while powerlifting tend to be an extension-based strategy, tend to be a compression-based strategy, and those things tend to limit rotation at the shoulder and at the hip. And you only need so much to be a successful powerlifter, but sometimes heavy barbell strength training in the sagittal plane takes away enough of that hip rotation and shoulder rotation that it becomes a problem. So all these breathing drills that we like to use kind of get these guys on the same page and create the stack, so to speak. If this is kind of a extended back position, flared and externally rotated rib cage, anteriorly tilted pelvis, lumbar extension, we're kind of looking for a more flexion-based strategy to return to neutral, to get the ribs on top of the pelvis again, to create the right skeletal position so that muscles can do the right things. And this is kind of all based on a lot of the stuff that you see from the Postural Restoration Institute, which definitely kind of brought the whole idea of like a more breathing drill, flexion-based component into the strength training world. And then there have been a lot of really good coaches who have kind of expanded on it. Guys like Pat Davidson, who have really helped bridge the gap from what PRI teaches to the strength training world. Guys like Zach Couples, who I think do a really, really nice job of simplifying all these concepts, because this can get pretty heady. This can get really, really intense in terms of just like the anatomy and the sheer number of drills. But I really like the way that these two guys kind of bridge the gap from the physical therapy world into the strength training world. So what we're going to do whenever we're doing any of these drills, first things first is alignment. So making sure that our skeleton is aligned in such a way to create the right amount of muscular tension in certain muscle groups that are perhaps inhibited. So things like our anterior core, specifically like our internal obliques, things like our serratus anterior, things like our hamstrings, these muscle groups that tend to not be in the right position to contribute muscularly when we're in like a big extended position, and then to kind of inhibit other muscle groups that tend to be overly tense and overly tonic because, again, of that extension-based position. Things like pecs, things like lats, things like spinal erectors, trying to inhibit those muscles. So, and none of that can really happen until you have the right alignment. So the first thing that we always focus on when we are using these breathing drills is making sure that everything's lined up the way that we want. That all the bones, so our rib cage and our pelvis specifically, our spine comes along for the ride, humerus comes along for the ride, femurs come along for the ride. Those things are all lined up the right way, then the drill will actually work the way that we want. And once we have our alignment correct, we're looking at using our breathing in order to influence muscular activity, because when we breathe in and when we breathe out, it does kind of shift from our sympathetic nervous system to our parasympathetic nervous system to allow all that muscular tension to just kind of relax and release, because we're not going to have an improvement in range of motion until there's relaxation. And that's something that Zach Couples has really helped me understand is, I think when I first started coaching these drills way back in the day, we taught them in more of like a high threshold strategy. And I do think it's warranted in some cases, because if you're working with people who are really, really, really stiff, like big, strong power lifters, or when I first started using these drills, high-level baseball players who carried a shit ton of muscular stiffness in things like their lats and things like their lateral hips, just from the nature of the sport that they played. Sometimes you needed a high threshold strategy for example, like exhaling hard, exhaling into a balloon, as you'll often see at a lot of these PRI courses, that like forcing a really long exhale. Is that really going to decrease muscular activity? Probably not, right? It's probably going to increase muscular activity in a lot of certain muscle groups. So it may get the point across in terms of muscular awareness. You might need a high threshold strategy to actually get into a stacked position if you're a really stiff individual, but you're not going to see an increase in joint range of motion until you get a decrease in muscular tension. And that just makes sense, right? If a muscle is like tense, if a muscle is like guarding because you're taking something to its end range, you're going to have a hard time improving range of motion. So that's going to kind of influence the way that I teach you guys to coach up these drills, because I have kind of had a bit of a change of heart on the way that you set it up, so the way that you align it, and then the way that you conduct the breathing aspects of it. So we're going to use 2 drills here, and we're going to use a little bit of like before and after stuff, test, retest, in order to kind of see if these things work. All right, so we've relocated. So now we're actually going to get into the test, retest. So we'll test hip or shoulder rotation, do the breathing drill, and then retest after to kind of see the changes that we can make. So Chris, I'm going to have you come up first, and you're going to be my hip guy. So I'm going to have you lay on your back with your head here and your feet here. And we're just going to do some passive hip rotation, range of motion stuff. So we want to have adequate hip internal rotation, specifically to squat deep. We talked about it before, where like when you start to go into a squat, your hips need to externally rotate, but then to kind of go from like 60 degrees to like beyond 100 degrees of hip flexion, you need a lot of hip internal rotation. When you're deadlifting or hinging of any kind, it's primarily hip internal rotation that accompanies the hip flexion. So having good hip internal rotation is really, really important. And it's probably the first thing that tends to disappear a lot when you're in a lot of anterior pelvic tilt and lumbar extension. So we want to restore that with some of our breathing drills. So what I'm going to do here is I'm just going to take Chris through some passive hip rotation stuff. So we've got his right hip here. We've got to take him into some hip flexion just to kind of loosen him up a little bit. We'll look at external rotation first. So we put him into external rotation. He's got pretty good range of motion there. He's got certainly enough external rotation to squat and to deadlift. Then internal rotation on his right side. He's actually pretty good there too. What we tend to see a lot, especially for like stiffer individuals who live in a lot of extension, is they tend to have decent external rotation, and then their internal rotation is pretty limited. But Chris is pretty good here. I can take him pretty far before I start to feel any sort of resistance here. But by having it head on to the camera, we can get a pretty good idea of his improvements there. We'll check the same thing on the left side. So into hip flexion, back to neutral, checking external rotation. Definitely got more on this side. I don't know if you can feel that. That feels a lot more free and easy to me. A good amount on this side too. So Chris has got pretty good rotation in his hips. We'll see if we can add a little bit more. So Chris, what I'm going to have you do is we're going to do a 90-90 hip lift, or sometimes called a supine 90-90 hip lift. So I'm going to have you lay on your back with your feet here and make sure that we're far enough away that we can see what's going on. All right, so this is one of my favorite drills to help improve hip rotation. So setting up the alignment's really, really important. So Chris is on his back. He's got his feet against the wall. He's got 90-degree angles between his knees and his hips. And we're going to use a yoga block here to put between his knees. We don't often do this in the group setting just because we don't necessarily have enough yoga blocks or medicine balls. But by having something to adduct the hips into, it's going to help kind of set the pelvic position that we want. And then there's a really important sequence of events here, things that we want to feel and ways that we want to align our skeleton to make sure that everything's in the right place. So first things first, we need posterior tilt of our pelvis. And I think I've been probably coaching this, like not in the best way for years and years and years, and I've coached it by saying to push the lower back into the floor. And I think probably what happens if we push our low back into the floor, and Chris, go ahead and do that. You can see that Chris's rib cage position changes a little bit in relation to his pelvis, and it looks like it's stacked, but we're probably over-relying on rectus abdominis to actually kind of crunch and flex the spine, where we don't really want spinal flexion here. We want more pelvic posterior tilt. So probably the best way to put it is to take like the bony parts of your lower back, so like your sits bones, and kind of push that into the ground to tilt the pelvis up. And it's a really subtle difference, but I do think it's important because we want to move the pelvis. We want to move the pelvis independent of the lumbar spine. And this may be kind of hard to get people to figure out at the beginning. Like push your low back into the floor is like such an easy one. But if you think more about like put your back pockets onto the floor, or push your belt line into the floor, something like that is going to get more posterior tilt without over relying on rectus abdominis to flex the spine. So once you have your sits bones pushed into the floor, that should give you a little bit of abdominal tension. And then the next thing we want to look for is hamstring tension, because our hamstrings are going to be pulling on our pelvis as well into the right position. So the way we think about this is just gently dragging the heels down the wall, not to the point where your feet would actually move, but to the point where you just create a little bit of tension in the back of the legs. So we get the foam roller squeezed, we get our sits bones into the floor, we dig our heels into the wall to create hamstring tension, and now we're going to do our breathing. Now that we've got our spine aligned, we're going to use breathing to kind of facilitate more muscular relaxation. So the way we want to think about this, and the way where it's a little bit different than the way I've coached it in the past, is we want everything to be low threshold. So we want things to be kind of nice and easy. So the inhale through the nose wants to be silent. We don't want to take a big sniff, like, because when we do that, that tends to drive more extension, and it tends to drive a lot of neck activity. So we think about just breathing in silently to fill our chest and our stomach with air. So go ahead and take a big breath in, Chris, through your nose silently. You can see Chris's chest and his stomach rising together. And as we exhale, we want to think about exhaling like we're fogging up a window, like we're, showing somebody like our coffee breath or something like that. So it's not a pursed lips, like blow up a balloon or blow out a candle. It's more of like an open mouth exhale, and that's going to make things a little bit more low threshold. So in through your nose silently, everything comes up together. Gentle exhale, fogging up a window. And you can see it's a little bit more of a subtle change in his rib cage position. If Chris exhaled really hard, it'd be easy to get his ribs and his pelvis to kind of get on top of each other, but we'd be probably creating more muscular stiffness or activity than what we would want instead of getting it to relax. So Chris, go ahead and do 3 more of those. Again, in through the nose, silently. Music's playing, so I can't tell if it's silent or not, but I trust you. Then long, slow exhale. Yep, you can see that motion is very, very subtle. That's what we want. It doesn't have to be a really aggressive change in the rib cage and pelvic position. And then last one. Good, quiet inhale, and then long, slow exhale. Cool. All right, go ahead and relax. And then we'll test and retest. We'll do the retest part. So I'll have you lay on there again, and we'll look at specifically your hip internal rotation again. So we'll have to use kind of our visual memory to remember what it looked like. So we'll go external rotation again. About the same, maybe a little bit more. Internal rotation. Chris had a lot to begin with. He certainly got more the second time around. So by lining up his rib cage and his pelvis and reducing muscular stiffness by doing the breathing, we gained, I don't got goniometer eyes, but certainly gained an appreciable amount of hip internal rotation. We'll check the left hip as well. This is the one where we saw before. He had probably more rotation in both directions. Yeah, definitely got a good amount of internal rotation here, a little bit more than what he had before. So that's something that I think is important to recognize. And Chris, you can go ahead back to your seat. Thank you so much. So I think the reason why these drills are so helpful is because people can do them on their own. You don't need like a skilled interventionist, like somebody who's going to do like soft tissue work or something like that. You can certainly gain that hip internal rotation by like foam rolling, like sitting your ass on like a lacrosse ball or something like that. But not everybody does it, to the degree that you would need in order to open up that range of motion. Stretching probably has a pretty low ROI. You probably have to like static stretch your glutes for quite a bit longer to make a change like that. But by simply just doing like 5 breaths of a 90-90 hip lift to be able to gain 10, 20, 30 degrees of hip internal rotation in just one drill like that, I think that's what makes them so useful. You know, and I think a lot of people would argue that these changes of range of motion are transient. They absolutely are. You know, we're just changing muscular stiffness. We're teaching people to relax. And of course, as soon as you lift heavy again, you're probably going to lose some of that range of motion. But all we're doing is we're just giving people adequate range of motion to be able to do the training that we want to do without compensation. And then hopefully if we squat and deadlift and lunge and split squat and one leg RDL through full ranges of motion, those ranges of motion will hopefully stick around. But if nothing else, it's just allowing us to kind of train in a more effective position. So that's the 90-90 hip lift. Let's talk about an upper body one. So we're going to use Ryan as our example for shoulder internal rotation. We're going to do quadruped breathing on our forearms. So what we'll do now is we'll actually spin this around. I'll have you put that one right there. And we'll look at shoulder rotation. So I'll have you lay with your head here and your feet there. Yeah, and you can stay in hook lying. And when we are testing stuff like this, I do like to test in a hook lying position because hook lying, much like the supine 90-90 hip lift, kind of aligns the pelvis a little bit better, so it gives us a more authentic idea of shoulder rotation. So similarly to testing Chris's hip rotation with Ryan, what I'm going to do is I'm just going to move him through shoulder flexion first, just to kind of get things to loosen up. And then when I'm looking at shoulder rotation, I want to put the humerus kind of up at 90 degrees, have one hand on the humerus, the other hand on the wrist, so I can kind of rotate them both together. So I'm getting an authentic idea of shoulder rotation. If I just like grab from here and pull and have my hand here like that, I might be getting more motion at the forearm. I might be like substituting valgus stress for actual shoulder rotation, so I can kind of help by having my hand on his bicep right here, which is all I've ever wanted, is have my hands on Ryan's bicep. So I check external rotation first. He's got a really good amount of that, certainly enough to get into a back squat position, certainly enough to create external rotation torque, you know, when he's setting up for a bench press. When I check internal rotation, I actually like to go into just a little bit more of adduction and then put my knee kind of right under their elbow to kind of give them a pivot point, but still having one hand on the wrist and one hand now on the tricep to look at shoulder internal rotation. And this is the one where we typically expect people to not have quite as much. And when we don't have adequate shoulder internal rotation, that mostly has implications on the bench press, because when we bench press, we're setting our upper back, we're setting our shoulder blades in position, and then we're going through shoulder extension to bring the bar down to our chest. But for every little bit of shoulder extension we have to go through, we do need some humeral internal rotation. If we don't have good humeral internal rotation, the way that our body is going to kind of steal it is by our shoulder blades going into elevation and anterior tilt. And we've all seen people who kind of dump the bar forward when they bench press from that shoulder blade coming into that position. Sometimes it's a lack of upper back strength or upper back isometric strength, but sometimes it's just that as we're going through humeral extension, we don't have the internal rotation to keep going, so that shoulder blade just kind of dumps forward. So that's for the bench press. And then especially for low bar squatters, we think of mostly of needing like a lot of external rotation in order to get into a back squat position. But especially for low bar squatters, as we pull that bar down, I'm no longer going into shoulder external rotation. I'm going into shoulder internal rotation. And same deal with the bench press. If I don't have enough shoulder internal rotation to kind of like pull the bar down into me into a low bar back squat position, that shoulder blade's then going to dump forward to kind of make up for that lack of shoulder internal rotation. And that's obviously going to cause irritation over time to the front of the shoulder and the medial elbow. So shoulder internal rotation is very, very important for back squatting as well. Ryan, let me have you spin around for the other side so we can show your left shoulder rotation to the camera. So again, go through shoulder flexion, just to kind of reset everything. External rotation, a lot of it. You did not play baseball growing up, did you?
I did.
You did? Okay, never mind. Well, there goes that.
I'm weird though, because I threw a football left and baseball right.
Okay, so here's the interesting one. This will be the interesting one to see. The left side, you feel the difference between the two sides? So definitely a lot of external rotation, which is often accompanied by less shoulder internal rotation. So we'll want to keep a specific eye on that left side as we do these. Okay, go ahead, hop on up. And we're going to do a breathing drill called quadruped breathing, which is just kind of like a take on like all fours breathing that we've used for years, but something that's I think a little bit more specific to the shoulder blades and the rib cage. I'm going to get rid of this box real quick and then have you're going to set up on this side. You're going to go into quadruped with your knees far enough back that when you have your forearms on the box, you can kind of tuck your hips under, kind of push out your upper back a little bit, and then lift your head so you're kind of in this position right here. And what this is going to do, especially compared to like an all fours breathing or what we'd call like way back in the day like an all fours belly lift, is it's going to be more specifically expanding the back side of the rib cage instead of just like pushing and using like our shoulder blades and our humerus to kind of create that. So I'm going to have you tuck your hips under even more. And then I'm going to have you push this back into my hand a little bit and then lift your head up just enough that you start to kind of feel that stretch through here. And what we're looking for is we're looking for creating more of a foundation for our shoulder blades to sit on. And we're going to do that by using our breathing. So do a gentle push down into here with your forearms. I'm going to put my hand on your sternum, and I want you to think about poking that up towards the ceiling more. You can see how Ryan starts to expand here a little bit. Now we're going to use our breathing to kind of solidify this. So same as what I was coaching Chris through, do a long, silent inhale through your nose, trying to put the air right here. And then an open mouth exhale while gently pushing your forearms down through the box. And what that's going to do, that should give him a good stretch kind of through his lats, kind of through this, what we call the posterior mediastinum. And he should be getting some good serratus anterior as well. All that is going to kind of change the shape of the rib cage by just reducing muscular tension in all the muscles that create spinal extension and kind of compress the backside of the rib cage. We're opening all of this up. So as I'm talking nonsense here, you can continue to kind of go through that silent inhale and long, slow exhale. Big focus on inhaling through here and then exhaling gently while pushing your forearms into the table. And this is a much less aggressive position, like flexion-based position, than what we would do like with our all fours breathing in the past. But I think it's a more authentic way to kind of increase range of motion through the humerus. Go ahead, do one more big one, and then we'll do the test retest. And hopefully we'll see some improvements in Ryan's shoulder internal range of motion. All right. Yeah, plop that guy back here. So we determined it was your left side that had probably less internal rotation than the right. All right, let's check that one first. All right, so again, we know Ryan had a lot of external rotation on this side, and he's been able to maintain that. That's good. Sometimes when you do these drills, sometimes you give away one range of motion in order to pick up the other one, which sometimes is a compromise you want to make. But I think if we can keep the external rotation and then just gain internal rotation, I think that's a very positive thing. All right, so we definitely picked up some internal rotation motion there. You can see if that's why having your hands in the right place is really important doing these tests. If I just kind of dump Ryan like that, it can look like he has more shoulder internal rotation. The head of his humerus kind of popping forward. That's that exact thing I was talking about when it came to losing your shoulder position in the bench press. So maybe picked up a little bit there. Go ahead, spin around the other way. All right, we'll check this side as well. So external rotation has an absolute shit ton of it. So you definitely picked up some external rotation there via that. And more internal rotation on this side for sure. So we picked up range of motion on the right side. We didn't pick up as much on the left. So maybe we'd have to look at something like doing a more high threshold drill. Maybe there needs to be like something done for your pec, something done for your lat, one of those internal rotators that needs to reduce more muscular stiffness to make that improvement. But thank you for doing that. So those are our two go-to drills that we're going to use to help improve hip and shoulder rotation. For the hip specifically, using the 90-90 hip lift to improve shoulder rotation using some sort of quadruped breathing. I like to start on the box because it's a little bit easier for people to organize their body in the right spot. A lot of times in the group setting, we've been doing it on the floor just for ease of equipment. What's tough about doing it on the floor is that if you're doing that quadruped breathing on the floor, a lot of people will default to being in like more of an extended position like this. So as I sit my butt back, it's kind of easy to kind of get into more T-spine extension than what we want, where we're actually looking for a little bit more T-spine flexion. And it's easier to do that when your knees are below your shoulders. But I think the main things that we want to focus on coaching-wise to make these drills more effective is changing the way that we're aligning people a little bit. So for the quadruped breathing, instead of doing like, old school all fours belly lift, where we're just going like super flexed and we're like pushing hard into the table and like getting spinal flexion at all costs. This is not good. This is like a high threshold strategy, so it's not going to create any relaxation. So just changing to a quadruped position so that we can actually relax those muscles on the back side of the body a little bit more. And then for the 90-90 hip lift, instead of coaching like push the low back into the floor, think more like the sits bones. So the bony prominence right here at the lower back. You could call it the belt line. You could call it your hip pockets, but just something instead of rounding, instead of flexing at the spine, we're actually posteriorly tilting our pelvis. And that's the only difference that we're looking for there alignment-wise. And then the way that we coach the breathing, definitely coaching more of like a low threshold strategy. So like silent inhale, I think that'll resonate with people because people can tell, even if the music's loud or whatever, people can tell if they're making noise, if they're doing like a loud sniff. If you just do that, you can feel the tension in your neck, you can feel the tension in your abdominals versus just like a more relaxed, like silent inhale. We can move our ribs without having to create so much muscular tension. And then on the exhale, coaching like some people call it a sigh. I think like the analogy of like fogging up a window makes a lot more sense. So this versus like again, low threshold, muscular relaxation, high threshold, muscular tension. So I think if we coach the breathing that way, all these drills are going to have a little bit better effect. Typical prescription is 5 breaths. That seems to be like enough to create a meaningful change. In the case of like Ryan's left shoulder, maybe you would have needed 6 to 10 breaths or like 2 sets of 5 to get a more pronounced improvement in shoulder internal rotation. Or maybe there's a bony situation. Maybe you've got acquired shoulder retroversion on that side. Were you a left-handed thrower? For football. Okay, so there you go. Maybe you acquired, shoulder external rotation and lost shoulder internal rotation via changes to your glenoid. An example with me, like my hip rotation on my right side is not coming back by like doing these drills, right? Like I've got like enough arthritis in there that I'm not going to, you can't breathe changes into bone. It's only creating changes to muscular stiffness. So to that point, these are not like going to save anybody who's got bony changes, but for the majority of our clients who don't have any issues with that, it's going to reduce muscular stiffness enough to increase hip internal rotation so they can squat and deadlift better, improve shoulder internal rotation to the point where they can bench better, they can get in the back squat position better. But there's a lot of power to those drills. They're very safe to do. Even if people don't do them right, they're not going to fuck themselves up. So that's a win in my book.